Well, welcome everyone. We're so glad you could join us for this Move with the Mayor's briefing, hosted in partnership with the African American Mayors Association and the National Forum for Heart Disease and Stroke Prevention. AAMA and the National Forum have been partners for 6 years now. And over the past four, the National Forum has been a proud member of the AAMA Business Council. During that time, AAMA members have participated in many facets of Move with the Mayors, one of the National Forum's signature initiatives. Mayors use Move with the Mayors to encourage active, healthy living while strengthening individual and community resilience. For 12 years and counting, mayors have used Move with the Mayor messaging, programming, policy guidance, and infrastructure recommendations to empower and protect their residents from health threats and improve cardiovascular and mental health. Last year, AMA and the National Forum partnered to host a webinar highlighting AMA mayors who are making an impact in their communities by promoting the importance of mental health and physical activity, particularly in communities most affected by chronic disease. This year, we're pleased to partner again with Move with the Mayor's Mental Health and Physical Activity Initiative, highlighting mayors who are making a difference in their communities. Some of you may even remember the Move with the Mayor walk to the Washington Monument hosted during ALMA's annual meeting in April. An energizing reminder that leadership in health starts with simple, everyday steps. Today, we'll hear more about Move with the Mayors and learn from AMA mayors who are creating healthier, more connected communities through this initiative. To share more about the program, please welcome John Clymer, Executive Director at the National Forum. Thank you, John.
Well, thank you, Phyllis, and thank you to the African American Mayors Association for your continued support. As Phyllis said, for 12 years, Move It the Mayor has helped local leaders use your trusted voices to inspire movement, strengthen community connection, and protect residents' health. In addition to our partnership with AMA, we're grateful to the CDC, the American Public Health Association, and the National Association of City and County Health Officials, and our corporate sponsors for making Move It the Mayor possible. Through Move With the Mayor, we've worked alongside mayors to tackle some of today's most urgent heart or health challenges, heart disease, stroke, and mental health, by creating communities where connection and movement go hand in hand. More than 230 mayors in nearly 40 states have used Move With the Mayor to empower and protect community members to thrive. Over the years, more than 70 cities across 27 states participated in Move It the Mayor programming, many of which engage in multiple campaigns like flu prevention, cholesterol management, mental health, and physical activity. Mayors have led community walks, hosted heart fairs, filmed PSAs, and partnered with local organizations to make health accessible to everyone. We're thrilled today to have two of those mayors with us now. Evansville, Indiana Mayor Stephanie Terry, my fellow Hoosier, and Stockbridge, Georgia Mayor Jayden Williams, who will be using or are using in their communities Move It the Mayor to strengthen health all across the community in creative and inspiring ways. Now, before we hear from Mayors Terry and Williams live, let's take a look at the PSAs that they filmed highlighting the importance of mental health, physical activity, and social connectivity.
Here's what I've learned for myself. I feel better when I don't try to do everything alone. Making time to connect with others helps me manage stress, it helps me clear my head, and stay consistent with being active. It's good for my mental health, my physical health, and most importantly, my heart. Join me for a Move with the Mayor then. Let's connect, let's move, and thrive together.
Learn how you can connect with Move with the Mayor. Click the link in the description below.
So Mayor Williams, I hear, rumor has it that Stockbridge is trying to be the most active, connected city.
We're already leading that charge, Mayor Starter, and I'm challenging Jonesboro to keep up.
Challenge accepted. Moving and staying active is more than about what it can do to your physical body, but it's also the mental health that it can provide. So you'll see me out moving in my community.
And in a city where community connects, Stockbridge is already pushing. And I hope the same for Jonesboro. So join us for Move with the Mayor.
Let's stay connected.
Let's move and let's
Thrive
thrive
together.
together.
Learn how you can connect with Move with the Mayor. Click the link in the description below.
Wow, mayors, you
Stockbridge,
really
I
rocked
didn't
it.
fully understand this until I experienced it. When I connect with others, I handle stress better and I feel more balanced overall. Staying connected helps me stay active, and it also helps my mental health and my heart health. Join me for a Move with the Mayor event. Let's stay connected, let's move, and let's thrive together.
Learn how you can connect with Move with the Mayor. Click the link in the description below.
Those are terrific messages and highly impactful in your communities. We know that because the social media engagement rates were sky high for both of your messages, or all of your messages. So thank you. Mayor Terry, you are truly a hometown hero serving as mayor of Evansville. And this is your second time leading your community in Move with the Mayor. What made you come back to the initiative, and why do you believe it continues to be valuable?
Sure. First of all, thank you to AAMA and to the National Forum for providing this space and opportunity for us to learn and to share really the work that we're doing in our cities. This is, as you said, the second year for Evansville to participate in Move with the Mayor. And I think what keeps me coming back is that, number one, it's personal, but it's also meaningful and incredibly valuable for our community. When we first joined the initiative, our focus was largely internal. We'd work with our human resource team and our health insurance partner to bring back our employee health and wellness fair after nearly a decade. We expanded services at our on-site health clinic by adding a therapist, and I started hosting weekly walks with employees. And the goal was simple: create a work culture where people know their health and well-being matters. And I tell my team all the time that if you're not doing well physically or mentally, it's going to be hard for us to give our best to the people that we serve. And so as public servants, we have to take care of ourselves, and we're constantly reminding ourselves to do just that. And then this year, we expanded our efforts into the community with our Mile with the Mayor events. And it's given residents really an opportunity to get active while also connecting with local government in a different way. Some people come for exercise, some for just conversation, but others are there just to hang out with their neighbors. I think my friend circle has been coming to those miles with the mayor so they have time with me as well. But then on a personal level, Move with the Mayor initiative really has helped me keep myself accountable. I think many people would say that staying healthy is something that you have to continue to work at every single day. And I've really made a commitment personally, at least to walk 15 minutes a day. I take the stairs at City Hall instead of the elevator. We have 4 flights of stairs here at City Hall, and I can tell you that last flight still reminds me that I have work to do every single day. And then on another level, my family's own health challenges, have also reinforced just how important it is to prioritize wellness and encourage others to do the same. This also tends to be a priority for our city at large and our region because our latest health assessment tells us that we still have work to do. The report shows while we're making some progress in getting active, and so there's more health behaviors that are improving, we're still seeing growing concerns around mental health, chronic disease, and access to care, and especially for lower income families in our community. So Move with the Mayor is just one small way for us to encourage healthier habits and to keep wellness front and center in our community. I'm really glad to be a part of the effort.
Well, we're very excited that you are part of the effort, Mayor Terry. And I love how you're leading by example, walking those 4 flights of stairs every day. I know personally, I've seen people doing that. The heads of organizations walking to the top floor to their offices, and I've seen that while I've been standing by the elevator, and I thought, you know what? If she can do that, I need to be doing that too. I know that's good for me. So I think your leading by example really pays off. Mayor Terry, you've done so much in the community and getting people engaged, as you just talked about. What have you learned about the connection between physical activity, social connection, and community well-being?
Yeah, I think the thing that I've learned the most is moving your body just simply makes you feel good. I think we can all agree that physical activity is good for us, but there's something different about doing it with other people. When we're out walking together, people, they're not just exercising, they're talking, they're laughing, they're meeting someone new and building relationships. For an hour, they're stepping away from the stress of work and family responsibilities and everything else that life really has to throw at them. These events really have helped us break down barriers too. People might never attend one of our city hall meetings, but they'll come out to walk and they'll talk with us. And those I have found to be some of the most meaningful conversations. My last walk, there's an elderly couple that came to walk. They say they walk every Saturday at Wesleyan Park. But when they heard that the mayor was coming to Wesleyan Park, they couldn't pass up the opportunity to come and walk with me. And so that moment really reminded me that community well-being isn't just about the physical health. It's about connection. It's about belonging and knowing that you're not doing life alone. I think when we combine movement with that social connection, we're also strengthening both the individual health and the health of the community at the same time. So it's pretty special to watch.
And Mayor Terry, have you seen in the last 5 years any changes in overdose incidents and fatalities in Evansville?
Yeah, we still have some challenges to face. I mean, again, the health data reports are showing there are some positive movements in specific areas. We continue to see, our numbers stay pretty consistent in terms of infant mortality, chronic, heart disease, and so forth. But we are seeing some positive, movements in those the health data, and so we're continuing to ensure that we're promoting better mental health and awareness, increasing the need for access to care. There's a lot of work still to be done, but I think this committee as a whole is really committed, and I think that's what's special about the city of Evansville is the planning that we've done as a region. It's one of our top 5 goals is for us to have a healthier community and for individuals to be healthier. And so when we've got the business community, we got nonprofit organizations and other groups that are all working together around this common goal, I think we're going to continue to see the needle move in a positive direction.
Well, that's terrific. And clearly your leadership is making a difference. Like how you're seeing some positive trends develop as you are using Move with the Mayor more and as you're helping community members be more connected to one another and to the community as a whole, that's connected to some of these positive trends that you're seeing. You just talked about something very important, and that's the community goal that different sectors, different groups of individuals and entities within the community are joining forces on under your leadership. For your fellow mayors who are here, what advice would you give to them if they're looking for simple and practical ways to encourage participation and to build momentum around community health as you have done and are doing in Evansville?
Yeah, my advice is to do something you love. Be authentic. I think that's what builds momentum. I think for me, I really enjoy walking along our riverfront, so I make it a point to make daily walks. And when I'm walking down Main Street, I mean, the number of folks that are waving, I think, and encouraged by seeing me do that. We've also tried different approaches like hosting line dancing, Tai Chi at our local senior center. It was really fun. So experiences like that, I really think have allowed for me to share more of my personality with the community as well as connect with people in a different way. We've also found real value in building partnerships. This year for that Mile with the Mayor, we're partnering with various health and fitness businesses. Last month, Be Fit. This month, we're doing a Studio Height Dance Fitness Center that's coming out and collaborating with us. And I think, collaborations really like this give organizations not only an opportunity to highlight their work, but they're also encouraging the broader participation from the community. And it allows us as a city, as a municipality to expand our reach and really to heighten the awareness around the importance of community health.
That's great advice to your fellow mayors. And we, of course, at the National Forum are pleased that you're using Move with the Mayor to improve health and well-being in Evansville. And Move with the Mayor is available to every mayor to do the same in your community. So please check it out if you haven't already. And thank you, Mayor Terry. You are really an inspiring example of how leadership is making a huge difference in your community. So thank you very, very much.
Thank
Now I want to turn to Mayor Williams, and of course I'm actually doing this from the Office of the Surgeon General, where I just wrapped up a meeting, and I have some technical glitches going on, so working on those. And Mayor Williams, I'm pleased to introduce you and to have you comment on what you're doing in Stockbridge.
Yeah, absolutely. Thank you, Jonathan. First, let me say shout out to one of the best organizations, and that is AAMA and National Forum. I can say I joined you all for the mile during our national conference, and I might have missed you by 2 minutes, but I still did the walk anyway. But I'm super excited. I can tell you for a fact, as a new mayor of Stockbridge, a freshman mayor, as many would say, as mayors, we often look at the focus of roads and budgets and infrastructure, but I truly believe that the most important infrastructure for us is human connectivity. When we were able to gather people and have them move and build relationships with neighbors that they didn't meet, get healthier and feel more resilient, that's what Move with the Mayor meant to myself and our entire city here in the city of Stockbridge, whether it was line dancing in the City Hall's quad, whether it was doing our Unity Walk on Martin Luther King Senior Heritage Trail, or even doing the basketball tournament. It was just a fun way and opportunity for people to engage and really galvanize amongst leaders. I will say also, doing a little extra, we had to make it fun, and calling out our sister city across the street, city of Jonesboro, and us doing that friendly competition also gave us an opportunity to get our employees engaged. So they had the opportunity to also galvanize and meet some of our residents, meet some of our sister residents, and then also combine our teams together to make one holistic opportunity for all of us to move with the mayors.
Terrific. Terrific. So, Mayor Williams, what factors motivated you to bring this national initiative to Stockbridge?
To me, it was very simple. If I'm going to start, the goal was to never host events. The goal was for me was to create healthy habits for the city. So what we did was we intentionally designed activities that we knew our city would like to do, that we knew were fun, accessible, but also welcoming to every single age generation, along with fitness levels. I sat down with a few of our local fitness gyms and trainers, and they gave us a rundown of what they really felt would be most productive for the city, because it wasn't for everybody to run a marathon. Everybody knows we all can't run marathons, but what was most important was we could get every single community resident to participate. So even in the friendly basketball game, we had one girl, she called out the guys. She said, the girls need to play against the guys, and that's just null and void. We said, okay, and the girls won. It was an opportunity for them to have an engaging opportunity. And so moving forward, I really think physical activity and social connection is now becoming culture for the city of Stockbridge, because we're now doing more with activating our trails and our parks. But most importantly, we're creating public spaces for people to create opportunities for neighbors to connect. And that's one of the most important pieces for me. While we're a growing city of almost 40,000 people, let's also make sure that we're connecting with our neighbors. I was super excited. And to me, a healthier city is not just where people get active, but it's where people can feel safe, where they can connect and also move.
Yeah, what you're describing are vital conditions for health and well-being. And I'm really excited that you're talking about those, Mayor Williams, because that's what enables people to make decisions and make choices in their everyday lives that will help them attain optimal cardiovascular and metabolic and mental health. So thank you for your leadership. And you're a trailblazer. you're the youngest mayor to serve Stockbridge, and this is your first year participating in Move with the Mayor. I know we have some of your fellow mayors who are listening to you right now who aren't using Move with the Mayor yet in their communities. So, do you have any advice that you would give to them if they're considering using it to better their communities?
Absolutely. I would say Move with the Mayor is one of the best programs that I'm a part of. And honestly, it's because you all have an amazing staff. Your team working with my team was absolutely phenomenal. But the number one key for me was following that roadmap, especially as a first-time mayor. And to be honest with you, while doing this initiative, I was only in my 5th month as mayor. So the roadmap helped me to really organize logistics and lay out an overall view of what we can do in the city. But it also helped me to ask different questions, like how can I connect my parks to my neighborhoods, or how can I connect community events to long-term engagement, or even how can I do some city policies and procedures to support healthy lifestyles across social connections in general across the city. So I would just tell them, even when I just found out I earned gold on the roadmap. So shout out to my gold status. It's just confirmation that we're moving in the right direction for healthier statuses. But most importantly, it's telling me that we can reinforce commitment to creating healthier cities if we as mayors take the charge to really build upon it.
Yeah, and I'm so glad you just said that. I want to congratulate you, Mayor Williams.
Thank you.
For Stockbridge's achievement of gold. The roadmap that you're referring to is an assessment tool that communities use to assess where you are in terms of creating the conditions that enable everybody everywhere in the community to attain good health, and then where there are opportunities to make some changes, introduce some programs, or use some policy or infrastructure changes to strengthen everyone's ability to be healthy. So how, and we only have about a minute left here, Mayor Williams, but how have you used that roadmap as a tool beyond what you just talked about, guiding your activity? I'm glad you're using it for that. Was it worth the time that you invested in completing that roadmap exercise to get the feedback that we provided?
Absolutely. It was more than effort for me. One of my goals as mayor is to make sure that we're an efficient city for our constituents. And so not only did that help me with what you just stated, but it also helped me build more relationships, build those collaborations. And I have now a group called Move with the Mayor. And it's someone that a neighbor made out in District 3, and she literally is in there every day. Mayor Williams, what's the next incident, or what's the next initiative that we're doing? Because it got them excited to get out into their community. When people invest in our communities, we want to make sure that as elected officials and mayors, we can invest back into them. And so that roadmap is helping me tremendously along the way to build a brighter future for Stockbridge.
Well, that's terrific. I'm glad that it's valuable to you. And I want to call out for everyone else who's joining us that among the things that we learned as we were analyzing your inputs in the roadmap and reasons that Stockbridge did achieve gold status is that you're promoting mental health and physical activity through social media and local events. Stockbridge supports volunteer programs and intergenerational activities to strengthen social connection. You've partnered as mayor with Parks and Rec and schools, police, and local organizations coming together to promote community engagement. And you've advanced pro-connection public policies such as shared use spaces and safe walking and biking routes. So congratulations, Mayor Williams.
Thank you.
Thank you. Well, now I'm going to pass the microphone to my National Forum colleagues to share more information about Move with the Mayor. James Jones, one of our community engagement coordinators, will spotlight AAMA member mayors' participation. James?
Thank you, John. This year, 20 AAMA member mayors participated in our spring mental health and physical activity challenge. Here are a few examples of how the challenge was announced and uh, expressed across the country. Mayor Thomas welcomes all to join her in the Tour de Richmond Heights bike event. Mayor Ed Brown, we know he did some bird watching at Upper Darby and just completed some tennis in Upper Darby as well. And then Mayor Nelson Dice flexes partnership with Franciscan Hospital and paired activities like line dancing and even Taekwondo with clinicians to talk about priority health issues. So as you can see from quite a few of these flyers, line dancing continued to gain attraction as mayors encourage residents to literally step in the right direction. Mayor Fushi uses bike events to get residents to utilize its safe routes, while Mayor Simmons in Greenville, Mississippi, inspires future leaders to increase mental health awareness. And Mayors Booker and Mayor Sarter put together a day full of mental and physical health resources, walking, dancing, and everything in between for their residents. So on the top left, you can see a picture of Mayor Sarter and Mayor Williams. He mentioned the little friendly competition they had between employees. They combined their efforts and kicked off Move with the Mayor in this way. Mayor Thompson's commitment and community presence leads to year-round events like the stroll you see in the top row. And Mayor Sonia Brown steps out every Monday with a continuously growing line dancing series. And Mayor Tucker of Fort Wayne, Indiana, joins employees in a chair yoga session. Let's take a look at the national impact of Move with the Mayor so far this year. So I'll turn it over to my colleague, Jen Childress, Director of Programs. Jen?
Thank you, James. Across our campaigns, mayors have generated significant reach through PSAs and social media, amplifying messages about flu prevention, cholesterol awareness, and mental well-being. Shout out to all the AAMA member mayors featured in the PSAs. Across social media platforms, among all participating mayors in the most recent mental health and physical activity campaign that just wrapped, there were over 400 social media posts from participating cities, including more than 80,000 organic views on Move with the Mayor videos and over 4,000 organic comments and interactions and shares. Many of you shared your events on social media, including posting to Instagram stories and using assets from the Move with the Mayor toolkit, as well as being featured in your local news and media outlets. Each branch of Move with the Mayor that features a PS campaign spotlights select mayors across the country, and we have a record of achieving at least 14 times more than the national average engagement rate on social media compared to other videos on Meta. So here's a look at two more PSA examples featuring AAMA member mayors. First up, Mayor Sarter of Jonesboro, Georgia.
Nobody is talking about this, but the flu can raise your risk of having a heart attack, especially if you already have heart disease. I'm Mayor Darnia Sarter with the City of Jonesboro, and I want you to stay strong and healthy this season. Protecting yourself protects the people you love, and it helps keep your community moving forward.
Stay ready this season. Talk with your pharmacist or healthcare provider to see if getting immunized against the flu is right for you.
And next up, Mayor Katrina Robinson of Haiti Heights, Mississippi.
Hey, stop scrolling. You need to hear this. I am Mayor Robinson, and did you know high LDL cholesterol has no symptoms but has a major cause with heart attacks and in strokes?
I'm Jordan Bratz, nurse practitioner. Knowing your LDL cholesterol numbers can save your life.
Please do not wait. Make a move. Get your LDL-C tested today.
See your healthcare provider, go to a free local screening event, or order a free at-home screening kit today.
Don't forget, this is important and it could save your life.
So we're sharing these just as examples of multiple ways to plug in to Move with the Mayor. Being part of one program doesn't mean you have to be part of every arm of Move with the Mayor. We have a variety of offerings and would love to be able to share the assets with you and help you use them and lead by example. So if any of these interest you, we'll have more information at the end as well. But if you'd like more information about getting involved, we're launching the flu awareness programming just now in the next couple of weeks and getting started down that path. So if you're interested, please drop a message in the chat to us so that we can send you more info. As John mentioned earlier and Mayor Williams highlighted, in addition to raising awareness and hosting events, cities assess how they're implementing and advancing the proven gold standard recommendations for promoting heart health, social connectivity, and physical activity. The National Forum provides cities that complete a roadmap with tailored recommendation reports that highlight resources and examples to help strengthen and inspire community programming and policies. I'll now turn it over to our communications coordinator, Amanda Thomas, to share more resources. Amanda.
Thanks, Jen. We've developed a suite of free and ready-to-use resources to support mayors and city staff participating in Move with the Mayor. And these are just a few of the examples of the resources available. They include social media graphics and sample captions, flyer templates and fact sheets, and other materials that you can easily adapt. We also wanted to highlight a few resources because we know how important Black maternal health is for AAMA. So we've created a suite of resources to help spread awareness about maternal health, women's health, and children's maternal health. Okay, we've developed a toolkit that features maternal, women's, and children's health resources, and we wanted to also put a spotlight on a fact sheet that we also developed that features facts about how to talk about mental health to kids. And I also wanted to highlight the Move Your Way campaign that promotes approachable ways for people of all ages to engage in physical activity. And we've also heard some incredible stories from communities using Move with the Mayor to reach residents where they are, whether that be through health fairs, walks with the mayor, or partnerships with local schools and churches. And we just wanted to let you know to keep an eye out for soon to be released case studies that feature AAMA member mayors Angie Nelson Deitch and Van Johnson. And now I will turn it back over to John, who will lead us into a Q&A portion of today's discussion.
Thank you very much, Amanda. And boy, when Mayor Williams said earlier that what makes Move with the Mayor such a valuable resource for him and his community at Stockbridge is the team that's behind it, that resonated with me. And I think you just got a glimpse of what a great team there is to support you as you use Move with the Mayor in your community. So thank you, Jen. Thank you, James. Thank you, Amanda. Now, as Amanda said, we do want to open the floor for questions. So if anyone has a question, please drop it into the chat and we will do our best to answer. And I don't know that I'll be able to see them. So as questions come in, if one of my teammates can call them out, that would be helpful. In the meantime, Jen, how many of the communities did submit roadmaps this year? We heard Mayor Williams talk about how valuable it was to him and to Stockbridge. How many did that, and how have they used the feedback that we provided from the roadmaps?
Thanks, John. This year we've had 13 mayors complete roadmaps. Our team is diligently working on getting those roadmap recommendations report out. They will be in your inboxes later today. And each of these reports or recommendations have different case studies and examples like you've seen throughout and highlighted. We really get a lot of questions about what are other cities doing? How can we implement this in ours? And while the report recommendations aren't meant to be prescriptive, they're meant to just provide ideas and information. I see several mayors on here who have also completed year over year. And just wanted to see too if any of the mayors have any thoughts that they would like to add as well from your experience in completing it. I know Mayor Kim Norton of Rochester, Minnesota was on a minute ago in participating in Move with the Mayor for the past 7 years and completing the roadmaps each of those years, thinking about it as a strategy. I know one of our brand new mayors participating this year in a freshman year of Move with the Mayor, Hattie Portis-Jones of Fairburn, Georgia, and her team recently completed the roadmap as well. So we really like to spotlight what's going on. And by reviewing the roadmaps, we learn more about what's happening in your communities. And we love to be able to tell the stories about what you're doing, how you're leading by example, and share with others. So I'd love to open the floor too from any participating mayors who've completed the roadmap or reviewed it to get your thoughts too.
Well, Jen, thank you. First of all, it was an honor to meet you at the AAMA annual meeting, which was in April, and where I learned about the program. I was excited to learn about it and to say, yes, I wanted to participate. But given that May was the deadline for that, I said, well, I can start with what we're doing already. Because wellness has been a huge initiative of mine since I started on council back in 2014. And so the city of Fairburn has done a lot in growing wellness, both for our employees as well as the community. Well, that being said, I thought we were doing a lot. But the toolkit, although I got gold as well, it has shown me that there's even more that I can do, and that it really provides a roadmap and a holistic approach to dealing with this issue. And it also helps me in talking about it, both to my colleagues on council, to the employees, as well as the community as well. And I, like Mayor Terry, I'm a walker as well, and I love to do so. And it was a park that was in my community that sparked my interest in running for political office. So, wellness and exercise have been key, making sure that, I get all of the required immunizations that I have. And quite frankly, that's where I want to focus next, is the immunization, both for our senior community as well as the children in returning to school. As we all know, the conversation regarding that and the negative results that we've received because of the questions of immunization and those who've decided not to participate in it. And so I think that's a huge opportunity. And so that's where I'd like to embark upon next. But thank you for the opportunity. I'm just so pleased that I had a chance to present what it is that we are doing. And I will say, stay tuned, Mayor Williams, my fellow mayor and city to the south.
Thank you so much, Mayor Portis-Jones. We really value your leadership and appreciate your sharing your experience with Move with the Mayor and what motivated you to use it in Fairburn. So thank you very much for participating today and for all of your efforts to help everyone everywhere in Fairburn to attain optimal health.
Thank you.
Yeah, I met this morning with the Deputy Surgeon General of the United States, Paul Jung, and I'm mentioning that not to drop a name, but to tell you that he shared with me that last week he addressed a gathering of over 1,500 youth. These were, I believe, high school and college students from around the country who are considering occupations in health. And he said, one of them asked, what would be the best profession for me to pursue? in order to make the biggest impact on the greatest number of people's health? Would it be as a doctor or a nurse or as a pharmacist or in public health? And Dr. Jung said, my answer was that the best way to make a big positive impact on the greatest number of people's lives is to be a mayor or a governor of the state, that you have so much power, so much leverage to influence change in your community and to influence the choices that people make in their everyday lives that have the greatest impact on their health and well-being. So it's not nearly as much what happens in a clinical setting that affects people's health and well-being, because they spend nearly all of their time in the places where they live and learn and earn and pray and play and shop. And your policies, your influence, your infrastructure changes all affect those places where most health decisions that people make are taking place day in and day out. So your leadership, the importance of your role, is recognized by the highest health authorities in the United States. And we're so glad that you're using Move with the Mayor to help make your communities healthier. Those of you who aren't, we encourage you to check out Move with the Mayor. You can find it at nationalforum.org, or please drop a note in the chat right now, and one of our great team members will reach out to you promptly and we'll get you involved. So thank you so much for joining us today for this AAMA National Forum webinar. And now I'm pleased to pass the microphone to Landon Bailey, AAMA's Chief of Staff, to close this out. Landon?
Thank you, John. I appreciate that. Of course, good afternoon, everybody. As John mentioned, I'm Landon Bailey, Chief of Staff here at the African American Mayors Association. We want to definitely start by thanking the National Forum for just inviting AAMA out to be a part of this important conversation, and for your continued partnership, really helping our mayors to lead on issues that impact, health, safety, and well-being of all of our communities across the country. I also want to give a special shout out to all of our member mayors who are on the call, who've been doing the work, for your continued leadership and participation, specifically with the Move with the Mayors initiative. Because as you know, programs like this continue to remind us that public health is not just about what happens in the hospitals or in the doctor's office. It's really about prevention, access, trust, and community engagement. So anything that AAMA can do and that our mayors can do to help continue to create healthier lives for our communities, that is what we want. Also, I do want to thank you all specifically today for pointing out, some resources for Black maternal health, because the connectivity here at AAMA is especially important when we talk about it, especially for our Black women, for our families and our communities. These issues are deeply connected to a much broader public health outcomes, including chronic disease, access to quality care, mental health, postpartum support, and et cetera. So the ability to bring this up on a call, to share resources, to prioritize this for AAMA, for our mayors and their cities is really important. And if anybody is interested in participating with AAMA, a national forum on continued partnerships and initiatives, whether it's Move with the Mayors, whether it's on, maternal health, please feel free to reach out to them or reach out to me or anyone here at AAMA. And we're more than happy to get those things moving. But last but not least, to just get us out here today so everyone can continue their days. Again, thank you to the National Forum for your continued leadership and helping create some local impact. We encourage everyone to stay engaged with Move with the Mayors, not just today, but also moving forward in the future, and additional campaigns focused on heart health, flu prevention, and mental well-being. So thank you all again for joining us today and being a support and partner in all the work that we do. And we really hope you enjoy the rest of your day.